Healthcare has 4 different phases. The first is prevention, the next is treatment, after that is rehabilitation, and when nothing else can be done, palliation. Treatment addresses a diagnosis, and modern medicine excels in making diagnoses. It can label almost any condition. The one time that modern medicine does not do so well is when you have a disease that's due to a lifestyle or life event. These kind of things can't really be treated as something outside the body because they're caused by the person or the way that person responds to what they're going through. When we talk about specific conditions, the treatment of specific conditions can be put into a protocol. But when you look at a condition like a lifestyle condition, like a migraine or a headache or a pain, that becomes very individualized. And no two presentations of the same diagnosis are going to be the same. The reason why those happen will not be similar, and the way we treat them, therefore, must be different. Unfortunately, what happens is people receive a protocoled list of treatments with the expectation that the symptoms go away. And because many of the things that we use to treat are so potent, for the time that a person is on treatment, those symptoms are actually covered up. But because the basic factor that causes is never being addressed, at some point that pain may come back again or that problem will reoccur. So when we take a condition like migraine, the name has a very distinct meaning and it often pertains to headaches, but you could have 2 different people with migraines, and one could be very active, going to work every day and doing all kinds of things. The other person could be crippled and stuck in bed because they can't get out. They still have the same diagnosis. Now, when the treatment doesn't work, what should we do? We have to start looking at what's actually making those things unique for that person, and that would be a treatment called neural therapy. Now, neural therapy is a not so well-known treatment, mostly practiced in Europe and South America, that's very personalized. It looks at who the person is, what they're experiencing, and why they're experiencing it. And then from there, we seek to start treating what actually causes those problems. You see, 2 people with the same diagnosis won't have the same clinical presentation. What they will have is a difference in the way they respond having that condition. And that difference in the response comes from the autonomic nervous system, which is what we actually treat in neural therapy. Who needs neural therapy? Anybody can benefit from this, but the people who often find it are those who've gone through all the different investigations and treatments, and their diagnoses are not very clear. All the tests are normal, the medications don't work, and finally what they're labeled is having a functional neurological disease where no test reveals what they have, but they're suffering horribly. And this is one of the conditions where neural therapy works very well. It can take time for a disease to emerge sometimes. So people know something is wrong, but when they meet the specialist, they're not able to come to a conclusion as to what's wrong, or the tests are normal. This is the time where neural therapy can still help. Sometimes the disease has been diagnosed, the name has been applied to the condition, and a person has undergone all the treatment, but they're still not feeling better or as good as they could be. And sometimes it can be very frustrating for most of our colleagues as doctors because they know the person should be better, but they're not sure what's going on. This is another time where neural therapy can also be very helpful. If you know someone who's suffering like this, it's something worth considering.